Hello everybody, welcome to the EM Code. I'm Dr. Abdullah, emergency physician by occupation. Join my quest in asking right questions from right people to get right answers. Our guest for today is Dr. Abdullah Asad Siddiqui. He's a consultant emergency physician in a leading corporate hospital in Kuala Lumpur, Malaysia. He has an experience of more than a decade, so we have a lot of aspects to unfold. So let's do it by asking him questions. My first question to Dr. Asad would be, first of all, welcome to the EM Code. It's a pleasure having you here. My first question would be, how do you prevent burnout in emergency? You have been here for a long time. How do you keep going?
Hi, thank you so much for the invitation for me to speak about emergency medicine. What makes me charged up about emergency medicine? This is what I love. This is my calling, and I've been practicing emergency medicine since 2007, and I never ever went to work because I love emergency department so much. I never went to work. That's the reason why I never feel the need to be charged up. But I was very lucky because I met with a concept that says that you should treat illness with wellness. That's what keeps me going. I need to have a balance because emergency department can be very stressful. And when I'm out of the emergency department, I practice wellness, and that's my secret for striking a balance between illness with wellness.
The concept of illness and wellness is very interesting, and we'd definitely like to hear more about it. But also tell us, how do you maintain the perfect work-life balance? Where does wellness find place in your personal life?
I have to tell you that I was very blessed to meet one of emergency physician from America, 25 years my senior, and he has guided me pretty well, and he's still guiding me how to strike a balance with wellness. And I'm just basically following his guidelines, is that we need to think a little bit beyond of what we study and what we practice. And for me, the secret of staying healthy, which I started to do after becoming emergency physician, was to give up sugar. That has been the biggest strength for me since 2013, is that I have given up sugar since 2013 and carbs. Nothing has helped me more than that. And of course, the guidance that I get from my teacher. He is an American emergency physician. I will always be indebted to him for opening up my mind to think beyond the emergency room.
For sure, the role of mentor is huge in shaping your career in emergency and outside emergency. Moving to the more critical aspect of it, everybody has that one moment where without your intervention, the patient's life might have turned havoc. Since you are into the business for decades now, you might have had many such experiences. Would you please share one with us?
One incident that I cannot forget is I was working in a private medical center, and there was this boy who was stabbed on the chest, and he came in and his BP was low, his SpO2 was low, and he needed to be transferred to a government facility because in that private medical center he could not have afforded to be there. So, and I needed to take him out of the government facility very fast. And when I listened to his lungs, there was no air entry, and knew that this was tension pneumothorax. And in order for me to get him to the government facility fast, all I needed to do was needle thoracentesis. And the moment I did that right, his BP picked up, his SpO2 picked up, and he was well enough to be transferred to the nearest government hospital. And that intervention, I think, saved his life. And feedback that I got from the receiving hospital was that that small needle, just a small needle, did the trick for him to survive.
Indeed, a needle on time saves life in case of tension pneumothorax. And taking a look at other aspect of your life, that is diet and health by design. Coming to health by design, why did you think this, initiative was necessary, and what are the goals you aim to achieve?
Health by design. I have to tell you that health by design is not my idea. It was my wife's idea. It's her decision. And yes, I'm fortunate that I have this clinic, a wellness clinic, where we deal in a lot of nutrition and a lot of bioidentical hormones, a lot of metabolic diseases, all those things which we in emergency department see the worst of. And I'm just trying to work on both the ends right now. The extreme end where you see DKA and MIs and all the strokes, but I'm also trying to work on this end where I try to reduce the population of people going to this side, and that's where health by design. That means that our health is designed according to your need. It cannot be that one size fits all. Everybody has different needs, everybody has different requirements. So in health by design, we try to see what suits best to you. Once again, thank you so much for inviting me.
The Green Warrior course is indeed a very thoughtful course, especially for the new joinees who are very hesitant to ask questions. It also boosts their confidence in reading the basic workup at least, and definitely strengthens your foundation.
Right, we have in emergency department, we have red zone, we have yellow zone, and we have green zone. Traditionally, all the courses are catered to red zone or yellow zone. Even Trige, they're catered to, but there has never been any course that addresses green zone. And I was very, very lucky that I was involved in the Green Warrior course, which was catered to green zone, where they empower you with the knowledge to solve the cases without consulting so many people or disturbing so many people. The small things like reading the effective way of FBC, effective way of reading urine FME, effective way of reading ECG, effective way of history taking. All of those things was involved in the green zone, Green Warrior zone. I wish every hospital should have that.
What is that one advice you would want to give to the young emergency physicians who are graduating out?
My advice to the budding emergency physicians is that once you are done with your exit exams, that's not the end of it, that's just the beginning of it. And we got to open up our minds to know that there's a whole world out there that we don't know yet. And I have a problem with when we are so disciplined in one field of medicine that we don't know what the other person is doing. But there is a whole lot outside that we don't know yet. And we should never ever close our mind into exploring that, because that might change your world. So please don't ever do that.
Yes, indeed that's a very good advice, and the importance of staying updated with the latest advancement in every field helps you save some life or the other. In a high voltage corporate setup, there are huge controversies on gender discrimination. So have you faced gender discrimination firsthand, or how would you deal?
I agree that any sort of discrimination, not just mental, be it racial discrimination, be it gender discrimination, or any sort of discrimination will affect the mental health. So there's no need to talk about mental health separately. This itself can lead to a lot of mental stress. But fortunately, I did not did not come across any discrimination. I have always had very good people around me, and whoever I have been associated with, I want to say thank you to everybody, whoever is watching this video. Until my very last stay in emergency department in the government setting, everybody has been absolutely fantastic, and even now where I am, everybody is very good, and I grow because of them, and I have not had any discrimination so far in emergency department. We have females and we have males in almost equal proportion.
Thank you so much, Dr. Asad. Thank you for joining the EM Core. It was pleasure having you. We'll surely bug you to get more updates with your courses. Thank you.